Complications of CTDs. Number 1. General or multisystem complications. Patients with connective tissue diseases often face infections. Why does this happen? Imagine a person with lupus who is already vulnerable because their immune system is attacking its own body. Now add strong medicines like steroids or biologics. The body's defenses are lowered, so even a mild infection can turn serious. Osteoporosis is another common issue. A patient who has been on steroids for years may suddenly fracture a hip after just a small fall. This happens because the bones become fragile over time. There is also a higher chance of cancers. For example, a woman with dermatomyositis develops ovarian cancer a few years later. Or a patient with Sjogren's suddenly develops lymphoma. These links remind us why long-term follow-up is so important. And let's not forget, constant fatigue, disability, and reduced quality of life are everyday realities for many patients. Number 2, lupus or SLE. The kidneys are at great risk. Lupus nephritis can quietly damage them, and if ignored, it leads to chronic kidney disease. For example, a young woman may notice swelling in her legs, and tests reveal severe kidney damage. The heart can also be affected. Pericarditis, myocarditis, and accelerated atherosclerosis. Imagine someone in their 20s or 30s facing a heart attack because lupus has sped up their artery damage. Neurological problems can be frightening. A patient may suddenly develop seizures or even psychosis where the brain itself is inflamed. Others may suffer from strokes at an early age. Blood complications are common. Hemolytic anemia makes them pale and weak, and low platelets cause easy bruising. And pregnancy brings added challenges. With lupus and antiphospholipid syndrome, women may have repeated miscarriages or preeclampsia, making pregnancy a high-risk journey. Number 3, systemic sclerosis. Here the lungs are the biggest worry. Interstitial lung disease and pulmonary hypertension are leading causes of death. A patient who once walked easily may now struggle to climb stairs because their lungs can't function fully. Renal crisis is another dreaded emergency. Picture a person suddenly developing dangerously high blood pressure and kidney failure within days. Without quick treatment, it can be fatal. The heart may become stiff from fibrosis, causing irregular rhythms or heart failure. And the digestive system is also not spared. Severe acid reflux, difficulty swallowing, or malabsorption can lead to weight loss and poor nutrition. Number 4, dermatomyositis and polymyositis. Respiratory complications are common. Weak swallowing muscles may cause food to slip into the lungs, leading to aspiration pneumonia, or lung fibrosis can restrict breathing. Cardiac issues include myocarditis and arrhythmias, which may present as sudden palpitations or even heart failure. One of the most important associations is cancer. Dermatomyositis patients, especially, have higher chances of ovarian, lung, or gastrointestinal cancers. That's why doctors often recommend cancer screening soon after diagnosis. And muscle weakness itself can be disabling. Imagine someone unable to rise from a chair or lift their arms, losing independence in daily activities. Number 5, rheumatoid arthritis and overlap CTDs. Here, the most visible problem is joint deformity. Over years, fingers may twist, wrists may become stiff, and simple tasks like holding a cup become impossible. But RA is not just about joints. Extra-articular complications include vasculitis, lung involvement like interstitial lung disease, rheumatoid nodules, or pericarditis. Add to this osteoporosis, caused by both the disease itself and the steroids used for treatment. Number 6, Sjogren's syndrome. Eyes are the first victims. Severe dryness, called keratoconjunctivitis sicca, can even cause corneal ulcers and threaten vision. The mouth also suffers. Patients complain of constant dryness, leading to cavities, fungal infections, and painful swallowing. It can also affect the nervous system, with neuropathy causing burning or numbness, or vasculitis leading to painful skin rashes. The most feared risk here is lymphoma. Patients with long-standing Sjogren's may develop non-Hodgkin's lymphoma, which is life-threatening. Number 7, antiphospholipid syndrome, or APS. This condition is dominated by clotting problems. In veins, it causes deep vein thrombosis, or pulmonary embolism. In arteries, it may trigger strokes or heart attacks at a young age. Pregnancy outcomes are also poor. Women may face repeated miscarriages, preeclampsia, or restricted baby growth despite normal care. The most severe form is catastrophic APS, where widespread clots shut down multiple organs at once. This is a true medical emergency. Number 8, mixed connective tissue disease. This combines features of lupus, systemic sclerosis, and myositis. So patients may face a mix of complications: pulmonary hypertension, interstitial lung disease, or kidney involvement. It's like fighting multiple CTDs at once. Dr. Yogesh summarizes. The most dangerous complications in CTDs are renal crisis and systemic sclerosis, lupus nephritis, pulmonary hypertension, and interstitial lung disease, thrombosis in antiphospholipid syndrome, and malignancy in dermatomyositis and Sjogren's. Complications arise not only from the disease itself, but also from the immune system's overactivity and from the medicines used. That's why close monitoring, early recognition, and timely treatment make the biggest difference in improving survival and quality of life.